Hello. So today is Sunday. Happy Lord's Day, everyone. June 21, and it's Father's Day. Happy Father's Day, all. So now I'm going to do my COVID-19 update. First, let's go to Worldometer update. So today, June 21, coronavirus cases is now 8,940,212. Deaths is now 467,152. Recovered 4,753,346. Active cases is 3,719,711. Serious or critical 54,527, which is 1%. And mild condition is 3,665,187, 99%. Total cases, USA 2,330,769, Brazil 1,070,139, Russia 584,680, India 412,711, UK 303,110, Spain 293,018, Peru 251,338, Italy 238,275, Chile 236,748, Iran 202,584. New cases, Russia 7,728, Pakistan 4,951, Mexico 4,717, Bangladesh 3,531, India 1,061, Honduras 1,048, Bolivia 1,036, Oman 905, Indonesia 862, Ukraine 735. Total deaths, USA 121,983, Brazil 50,058, UK 42,589, Italy 34,610, France 29,633, Spain 28,322, Mexico 20,781, India 13,290, Belgium 9,696, Iran 9,507. Deaths, Mexico 387, Pakistan 119, Russia 109, Bangladesh 39, Indonesia 36, Guatemala 31, Bolivia 25, Philippines 19, Armenia 18, and India 13. That's all for my Worldometer update. Go to Qatar updates. Update, this was yesterday because we don't have it today. So yesterday, new cases is 1,026. Total cases now is 86,488, and the active cases is only now 19,631, which is good. And recovered cases yesterday is 1,354, with the total recovered cases of 66,763. One death yesterday. Total deaths now here in Qatar is 94. People tested within 24 hours yesterday is 4,193. Total people tested is 317,694. Now, private healthcare facilities in Qatar permitted to carry out COVID-19 swab tests. The Ministry of Public Health has decided to allow private healthcare facilities in the country to carry out swabbing for COVID-19 tests. Private facilities are allowed to do swab tests in case of these following categories: patients with COVID signs and respiratory symptoms, patient for admissions including acute admission and admissions for elective surgeries, healthcare workers, periodic testing of employees of other sectors, and for pre-travel certificate confirming negative COVID-19. People who want to travel outside Qatar must book at hotel in advance. This is compulsory now. Before you go out Qatar, you should have a booking for 2 weeks in a hotel for your quarantine. If you arrive here in Qatar, you should be quarantined by your own expense. Civil Aviation Authority announced in a circular issued on June 17 that passengers traveling out of Doha with a return booking must have a confirmed reservation in one of the designated quarantine hotels in Qatar on their return. Check under this article the hotels that you need to get the reservation. VCU Arts Qatar manufactures face shields for infants. QF Partner University continues community-wide initiatives to combat COVID-19, protecting vulnerable groups of people from contracting the coronavirus is a challenge facing healthcare professionals across the globe, especially when some of them barely weigh 3 kilograms, which is the babies. PH issues guidelines for praying in mosques. So the Ministry of Public Health has issued guidelines to perform prayers in mosques during gradual lifting of COVID-19 restrictions in Qatar. As many as 500 mosques reopened in the country on June 15 under Phase 1 easing restriction of coronavirus. I will share you also some of my videos during donning and doffing of our PPEs in the field. Please watch. So the virus is still out there, so stay safe. Please always wear mask if you go out. Always hand wash at least 20 seconds with soaps or hand sanitizers. Also avoid touching your face, especially your mouth, nose, and eyes. And maintain social distancing at least 2 meters away from each other. So eat well, nutritious foods, sleep well, at least 7 to 9 hours, exercise, and avoid smoking and drinking. So this will help to boost our immune system. All for my COVID-19 update. Be safe and God bless. But before I will end my video, I will share you some video clip in Hamad Medical Corporation. This video is an advice on precautions to follow during the gradual lifting of COVID-19 for private healthcare facilities services. Please watch.
I'm going to talk very briefly about opening up in the first stage for medical facilities. So the important first thing that they need to do is to have a focal person for this issue. Is that he's the one who's going to give the instructions or and also monitor what is happening in that clinic or hospital. They have to, in the beginning, to have an evaluation of the risk, and then they have to have a plan to mitigate this risk or eliminated. There has to be a register for any group activities like operations and so on, who are the people who are involved in it. And there is a form that all workers need to fill in when they start their work. The important issue is that we need to make sure that there is the social distancing between people and patients. And when we are saying 40% of capacity, so we need to make sure that there is separation screens between, say, the receptionists and this kind of clerks and their patients. Wherever it's possible, make sure that we have marks on the ground, so for those separations, or on the chairs where the patients will be sitting. We of course need to make sure that the PPE, personal protective equipment, are available and plenty for the people, for the staff who are working there, and everybody who's entering, they should be wearing their masks and using hand hygiene, and there will be questions when they enter, and measuring their temperatures.